For 60 years, the Philippine General Hospital Department of Ophthalmology has served as the premier eye referral center in the country. Since its infancy, it has provided care to hundreds of thousands of patients, whilst offering the most comprehensive ophthalmologic training available. Join us as we revisit the illustrious history of our department. In May 1911, the Department of Eye, Ear, Nose, and Throat of the University of the Philippines was established with Dr. Reinhardt Rembe at the helm. In 1914, Dr. Aristeo Rizal Ubaldo, nephew of Dr. Jose Rizal, became the first Filipino chairperson of the EENT department. At the same time, the PGH Eye Bank was also established. Ophthalmology was soon recognized as a specialty in itself, and on November 9, 1961, the UP Board of Regents approved the formation of the Department of Ophthalmology. Dr. Geminiano de Ocampo was named as its first head, and a formal residency training program was introduced. The subspecialty clinics of plastics lacrimal, cornea, glaucoma, uveitis, motility, neuro-ophthalmology, retina, and orbit were established. De Ocampo was followed by Dr. Emmanuel Almeida in 1966. He maintained the high standards of service and training, paving the way for his successors. From July 1968 to June 1976, under the leadership of Dr. Liborio L. Mangubat, additional residency positions were opened and residents were given more opportunities for eye surgery. In order to promote the pursuit of research and technological advancement, the Philippine Eye Research Institute was conceptualized in 1965. The term of Dr. Romeo B. Espiritu from 1976 to 1979 was a period of reorganization for residency training. Residents began to rotate in all subspecialties yearly, and the research program was strengthened by allowing residents to work on their topic of interest. Under his leadership, the basic course in ophthalmology was opened to all interested residents in the country. In 1979, Dr. Salvador R. Salceda assumed chairmanship of the department. Training and research were further strengthened through case consultations and scientific conferences. Dr. Salceda assumed the position of the director of the Philippine General Hospital in 1984, becoming the first ophthalmologist to hold such a distinction. In 1982, Dr. Gloria D. Lim became the first female chairperson of the department. During her term, several surgical instruments and ophthalmic equipment were acquired, including a visual field analyzer. Dr. Mario V. Aquino became department chairman in 1985. During his term, extracapsular cataract extraction and implantation of posterior chamber intraocular lenses was introduced. At this time, the department was also relocated from Ward 4 to Ward 12. In 1988, Dr. Romeo V. Fajardo was appointed as chair. The acquisition of an argon laser machine led to the establishment of the Eye Instrument Center in 1989. Residency slots were increased from 18 to 30. During his time, the Ophthalmological Foundation of the Philippines, through the generous donation of the Miyake family of Japan, established the Miyake Eye Operating Room, which housed equipment for phacoemulsification and vitreoretinal surgery. In July 1991, under the leadership of Dr. Prospero Maria C. Tuaño, the Pediatric Ophthalmology Clinic and the Low Vision Clinic were established. Residents started to perform phacoemulsification surgery. In 1995, the fellowship programs were formally established, which firstly included retina, glaucoma, and external disease. In February 1998, during the term of Dr. Robert Tan, the department formally came to be known as the Department of Ophthalmology and Visual Sciences. Dr. Manuel P. Agulto took charge of the department in May 2000. With a grant from the Spanish government, through the Agencia Española de Cooperación Internacional, a fully equipped eye center was built in collaboration with the University of the Philippines, the Philippine General Hospital, the Department of Health, the Philippine Academy of Ophthalmology, and other stakeholders of ophthalmic health. This institution is what we now know as the Centro Oftalmológico Jose Rizal, or SOJR, current home of the Department of Ophthalmology and Visual Sciences, the Eye Instrument Center, the Santa Lucia Eye Bank of Manila, and the Philippine Eye Research Institute. In 2006, the Fellowship Program in Pediatric Ophthalmology was established. In the same year, the department released the first edition of the Self-Instructional Materials in Ophthalmology, authored by department faculty. This would become a learning resource of medical students, not just from UP, but from all over the country. Dr. Ildefonso M. Chan served as the chair of the department from 2007 to 2009. It was then that the Dr. Romeo B. Espiritu Auditorium was inaugurated, coinciding with the centennial year of PGH in 2008. A clinical fellowship in oculoplastics in orbit was also established. Dr. Pearl Tameses Villalon led the department from 2010 to 2012. During her term, the department worked towards financial independence from the Philippine General Hospital. In 2010, the Cataract Clinic was established with the goal to improve the residents' surgical skills and to ensure better supervision of trainees. The DOVS celebrated its 50th anniversary in 2011 during the 5th year of operations of the SOJR. As part of the celebration, multiple service projects were initiated: a barangay health worker training and visual screening program, the first pediatric ophthalmological symposium, and 50 at 50, free ophthalmological surgeries for 50 indigent patients. On February 8, 2011, the Dr. Romeo V. Fajardo Library was inaugurated as a tribute to the department's former leader. Dr. Raul D. Cruz became chair of DOVS from 2013 to 2015. New equipment was acquired, and better coordination with the Philippine Health Insurance Corporation was achieved. In 2014, the department held the first basic course in phacoemulsification, a project of the Ophthalmology Residents Alumni Association. Dr. Marissa N. Valbuena was appointed as chair of DOVS in 2016. Increased consultant involvement and supervision was emphasized. In 2018, the department became the first to offer fellowship training in neuro-ophthalmology in the country. Dr. Valbuena's term continued the culture of excellence of the department and strengthening of the postgraduate courses, encouragement and support of research, and fostering of camaraderie and mentorship through active engagement within and outside clinics. In the year 2020, as the coronavirus pandemic struck, ophthalmology services came to a sudden halt. The SOJR OPD and ward closed down in an effort to protect both patients and staff. When the PGH became a COVID referral center, key personnel from doctors, nurses, and auxiliary staff were asked to man COVID areas to supplement the manpower of the hospital. But these trying times also paved the way for major infrastructure and staff role changes that have improved the quality of service delivery. Physical charts were converted to electronic records for both efficiency and infection control. Teleophthalmology for the management and assessment of ophthalmic symptoms, or TOMATO, was established and has served thousands of both new and follow-up patients. The Radish electronic medical record system developed by Dr. Homer Ko was adopted for OPD and inpatient charts, allowing easy retrieval of records and laboratory test results. New equipment such as slit lamps, HEPA filters, and acrylic barriers were also acquired, and the inpatient ward was restructured to make room for COVID suspect patients. As we transition to the new normal, we strengthen and adapt our training program to form graduates that seek for themselves unceasing self-mastery and improvement in clinical knowledge, surgical skills, research, and compassion. To date, The PGH Department of Ophthalmology and Visual Sciences has produced revered experts across the different subspecialties of ophthalmology, distinguished individuals who have become leaders and innovators of their fields. They have helped further ophthalmologic knowledge and surgical technique on local and international scales, elevating the field to new heights. Through changing times, they continue to be our teachers, mentors, and inspiration. In its 60th year, the Department of Ophthalmology and Visual Sciences remains committed to the provision of quality eye care for the Filipino patient and will remain so for many years to come.